Yeah, I mean, that's an absolutely critical question. I think it's at some level, it speaks to the fact that you're probably not critically ill with epilepsy. You know, you're living with seizures, you're living with this illness, and in many ways, families might speak to me and say that, you know, living with somebody with epilepsy for 10 years, they've got used to that schedule of medicines and hospital trips and recovering from seizures, and then one day is their last day. One day is the day that you die from that seizure, and that's the suddenly part of it. So people often ask why that day, why that seizure, why on that occasion, and a lot of that is not well understood, but is understood in a different way by the bereaved families, because that's a shared experience of living with somebody who didn't seem ill, and then you lose them suddenly with a seizure.
And I think just like epilepsy itself is an unpredictable condition, the risks associated with epilepsy are can be unpredictable as well. So we know that some of them can be modified, so can be changed, can be improved over time, but we also know that they fluctuate over time and can become more serious or less serious for people throughout their epilepsy journey. And what might be incredibly risky for one person doesn't necessarily mean it's risky for another person, especially because we know that epilepsy could be very different between people as well. So it's really important that people understand that risk profile as well and are able to take steps to keep themselves as safe as possible so that we can prevent as many of these deaths as possible.
We're not always very transparent at telling people that we now think you're at increased risk. This is why we're putting in additional appointments or trying hard with medication. But there are certain periods. So pregnancy is a risk period for people. Changing medications is a risk period, not just because you're changing medications, because seizures are frequent. And then lots of convulsive seizures, particularly from sleep, particularly if you're spending a lot of time alone. Those are things that worry me. And things that can change that would be new transit medication and making sure medications are taken reliably without gaps in it, without so not being able to get hold of your medicine for a couple of days from the pharmacy. That would be a big worry for me if people are going for time without their medicines.
And these things are all things that are covered in the SUDEP and seizure safety checklists for health professionals, but also in the Epsilon app that SUDEP Action created for people with epilepsy, so that you can really keep an eye on these things over time. Because we know that a lot of epilepsy deaths are potentially preventable by taking small actions to help understand and reduce these risks where possible. And that might not just be the risk of SUDEP, but it could be of accidents, of suicides, drownings, from mental health. It's all of these things are important of helping people to live as safely and as well with epilepsy as possible.
Yeah, I think the app's really important, Sammy, when also thinking about how the health service is sort of organised throughout the British Isles at the moment, because some people have got very long gaps between appointments. Some people's specialist nurse might have retired or might be ill, and the ability to do self-monitoring of your health in between appointments is critical, I think.